2009 were 27,236 and in 2010 the cases reported was 20,604. The number of deaths in 2009 were 981 and in 2010 the deaths increased to 1,763. Influenza is caused by virus of three types, A, B and C. It is the type A virus which has caused major pandemics and epidemics across the globe. This is because influenza A type of virus has the tendency to undergo mutation against which the affected population may not have sufficient immunity. The subtypes of influenza A virus include H1N1, H2N2 and H3N2. While declaring the pandemic to be over in August 2010, WHO had conveyed that the pandemic H1N1 virus would continue to circulate as a seasonal influenza virus for some years to come. In current year, from January 1 till February 22, 2015, the number of cases reported by the state are 14,673. The number of deaths for the same period is 841. For the information of the honorable members, years-wise, figures of the cases and deaths from 2009 to 2015 reported for influenza A H1N1 are being laid on the table of the House. Many of these deaths, however, may be due to already present comorbidities in the patients. The Union Health and Family Welfare Ministry has been very closely monitoring the influenza A H1N1 situation. We are in regular contact with governments of the affected states. For containment of the impact of this seasonal influenza, states have been provided guidelines on screening, risk categorization of patients, clinical cases management, and ventilator management. The drug oseltamivir is required for treating influenza A H1N1. In addition to prevent transmission of the disease to the healthcare workers who come in contact with the patients, N95 masks and personal protective equipment are required. We are on a regular basis ascertaining from the state governments regarding the stock position of the above items. Additional requirements, if any, required by the state governments are being met by us. We have already supplied to the affected states 58,000 of capsules of oseltamivir, 3,000 N95 masks, 9,500 personal protection equipment. We are also maintaining an emergency stock of oseltamivir drug to meet any sudden requirement. In addition, we have in stock 10,000 N95 masks and sufficient number of personal protective equipment. To guide and assist the state governments, teams from Union Health and Family Welfare Ministry have been sent to Telangana, Rajasthan, Gujarat, Maharashtra and Madhya Pradesh. For guidance of ICU and ventilator management, a team of doctors was sent to Rajasthan on 2 occasions. Video conferences for the review of the states are being held at the secretary level and other senior officers. On 19th February 2015, the Cabinet Secretary also held a video conference with the Chief Secretaries of the affected states to ascertain the difficulties and assess the requirements, if any. Regular review is also placed at my level. I assure the honorable members that whatever help is required by the state governments to deal with the outbreak is being provided by us. Certain media reports have incorrectly stated about the shortages of oseltamivir drug used for treating influenza A H1N1. I would like to inform the honorable members that this drug, recommended by WHO, is manufactured in India. We have held meetings with the manufacturers on 2 occasions. These indigenous manufacturers have confirmed that they have sufficient capacity of stock of active pharmaceutical ingredients to meet requirements. In fact, one of the manufacturers is a central public sector undertaking. The drug oseltamivir, however, cannot be sold over the counter. It is to be made available only against prescription by a qualified doctor and sold through chemists with license under Schedule X of the Drugs and Cosmetics Act. In addition, the drug is also available through the public health system. We cannot afford a situation where due to irrational use of drug, resistance is developed, rendering the drug incapable of fighting the virus. However, to ensure the general public requiring the drug does not have any inconvenience, we have advised the state governments to review the locations of Schedule X pharmacies and issue licenses for underrepresented or not represented locations. The Laboratory Network of Integrated Disease Surveillance Program and Indian Council of Medical Research, comprising 21 laboratories across different parts of India, is providing free testing facilities for influenza A, H1N1. These laboratories have sufficient capacity and availability of diagnostic materials. The position is being constantly monitored. Orders have been placed already for procurement of additional quantity of reagents. The affected states have further supplemented these efforts by authorizing private diagnostic laboratories for conducting tests. We were concerned about the certain media reports informing that very high rates were being charged by certain private laboratories. The Director General of Health Services has advised the concerned state governments to ensure that the private laboratories do not charge high rates. Rather, the rates should be fixed by the state government. It has been confirmed by both National Institute of Virology under ICMR and National Center for Disease Control, Delhi, that the case of influenza currently being reported are of H1N1 nature. In other words, it is the same virus of 2009 and there is no mutation in the virus. Consequently, the drug oseltamivir used during the time of pandemic 2009-10 remains effective for the treatment now also. As already stated, we have the diagnostic capacity and we are equipped and capable of detecting this virus. I would inform the honorable members that we have recommended vaccine only for the healthcare workers. Guidelines regarding the same have been sent to the state governments. This decision has been taken after due consultation with experts. Vaccination of general public is not advocated as public health strategy at this point of time, at this junction. Honorable members may also like to know that vaccination becomes effective after about 3 to 4 weeks of the injection and the immunity is only for about a year. Moreover, vaccination may not provide full protection against the virus. The healthcare workers are also advised to take proper precautions and use personal protective equipment while examining and looking after influenza A, H1N1 patients. In addition, it is recommended for the healthcare workers to take prophylactic dose of oseltamivir. As per information gathered by the state governments, it appears that many of the deaths may be attributed to the comorbid conditions of the influenza A, H1N1 affected patients. Such persons are immunocompromised and consequently more vulnerable. In this category are the patients with diseases such as cancer, diabetes, tuberculosis, other respiratory diseases, etc. The states have also been informed that in many cases the affected persons sought medical intervention at a very late stage, resulting in deteriorated health status of the patients. To increase awareness of the general public, the states have been undertaking massive information, education, communication, IEC campaign using different media. The campaign focus is on how to prevent the transmission of the disease as also an action to be taken within the onset of the symptoms such as cough, fever, etc. The central government is also supplementing the IC efforts of the states. Advertisements placed by us in print media were published on regular basis in more than 200 newspapers in January and February 2015 all over the country. These included advertisements in vernacular languages also. Radio and television are being used for information dissemination. States have been advised already to scale up the IEC activities. I would like to ensure the honorable members that the situation being closely monitored by us and all necessary assistance is being provided to the state governments. Adequate stocks of medicines, masks and PPE are available. I would further like to assure the honorable members that no efforts will be spared for effectively dealing with the situation.